Parkinson's disease is a major health concern in Australia, affecting around 150,000 people, with an alarming estimate of 9,500 new cases diagnosed each year. That's a huge number considering the population size. And globally, this trend isn't slowing down either.
Oh, wow, Brandon. I mean, those are staggering statistics. So, for our listeners who may not be entirely familiar, can you, explain what makes Parkinson's disease so, distinct compared to other neurological disorders?
Sure, it's a progressive neurodegenerative condition, meaning it worsens over time. The hallmark symptoms are motor-related, and we often refer to them as TRAP, tremor, rigidity, akinesia or bradykinesia, and postural instability.
TRAP, got it. But what does that look like in real life for patients?
Great question. For example, the tremor. It's kind of this rhythmic shaking, usually starting in a hand, even when it's at rest. Patients describe it as almost uncontrollable, like their hand just has a life of its own. It gets in the way of simple tasks, like drinking a cup of tea.
Oh, that must be incredibly frustrating. And rigidity, how does that manifest?
Rigidity involves muscle stiffness. It's not just feeling tense, though. It's like the muscles resist movement altogether. Picture trying to bend a metal rod. That cogwheel jerking effect is what patients often experience. It can cause pain too, especially when moving or being examined by a clinician.
And then akinesia or bradykinesia?
Right. Akinesia refers to difficulty initiating movement, while bradykinesia is extreme slowness. Together, they can make everyday actions, like buttoning a shirt, feel like running a marathon. Even facial expressions become less animated, which we call hypomimia.
So they might struggle to even, smile?
Exactly. And postural instability, the last in TRAP, affects balance and coordination. Patients often develop a stooped posture and shuffle when walking. Unfortunately, this dramatically increases their risk of falls.
It seems like such a huge impact on so many aspects of life. How do treatments help patients cope, though? Like, isn't Levodopa a common medication for Parkinson's?
Yes, exactly. Levodopa is fascinating, really. It's a precursor to dopamine, the chemical the brain loses in Parkinson's. Since dopamine itself can't cross the blood-brain barrier, levodopa is converted into dopamine once it's inside the brain.
Ah, so it's like replenishing the brain's supply?
That's right. And it's often combined with dopa decarboxylase inhibitors to stop premature conversion outside the brain, because once dopamine's in the bloodstream, it's useless to the brain. Together, this combo improves motor symptoms, letting patients regain some functionality, at least early on.
Early on? Does that mean it doesn't work well later?
Unfortunately, over time, patients often experience motor fluctuations, what we call the on-off phenomenon. Imagine one moment you're moving fine, then suddenly, out of the blue, you're immobile. It's a cruel irony that the therapy itself can lead to complications like dyskinesias, which are involuntary writhing movements.
Gosh, that must be incredibly tough to manage. It sounds like timing the treatment is just as important as the treatment itself, right?
Absolutely. Early intervention and precise medication timing can make a big difference. But there's still a lot of work to do in terms of improving long-term outcomes. And, it isn't just about the physical symptoms. It's about improving quality of life wherever we can. Just like Parkinson's disease, there's another neurological condition that presents an immense challenge globally: Alzheimer's disease. Here in Australia, the numbers are staggering. As of 2023, about 411,100 Australians are living with Alzheimer's disease. To put that into perspective, it's the most common cause of dementia worldwide, accounting for about 60 to 70% of cases.
That's an incredible figure, Brandon. So, how does Alzheimer's disease actually impact those affected? Like, what specifically happens in the brain?
Good question. Alzheimer's is characterized by the accumulation of two abnormal proteins in the brain, amyloid plaques and neurofibrillary tangles. The amyloid plaques are deposits that build up between neurons, while the tangles form inside neurons, disrupting their function. Together, they basically choke the brain's communication system, which leads to cognitive decline.
Ah, so that explains the progressive memory loss we often hear about?
Exactly. It starts subtly, forgetting recent conversations, struggling with names or dates, but over time, it becomes severe. We're talking about losing the ability to perform day-to-day activities and even recognizing loved ones. It's heartbreaking.
I can't even imagine what that would feel like. Are there treatments available to slow that decline? Or is it just about managing the symptoms?
Well, there's no cure, unfortunately, but medications like acetylcholinesterase inhibitors aim to improve symptoms, particularly in the early to moderate stages. These drugs prevent the breakdown of acetylcholine, a neurotransmitter crucial for learning and memory. Essentially, they boost the communication signals in the brain, at least temporarily.
So they help the brain's messages get through.
Exactly. Then, for moderate to severe stages, NMDA receptor antagonists, like memantine, are often used. These target another process, reducing excessive glutamate activity, which can damage brain cells. So while these treatments don't halt progression, they do offer patients a bit more time with better cognitive and functional abilities.
Time is such a precious commodity for patients and their families. But it sounds like the care goes beyond just medication, right?
Absolutely. Alzheimer's management is best handled by a multidisciplinary care team. You've got specialists working with nurses, occupational therapists, speech therapists, and even dietitians. It's all about combining therapies to address everything from cognitive decline to emotional well-being and physical health.
And I imagine there's a big role for nurses in supporting both the patients and their caregivers?
A massive role, Paisley. Nurses often bridge the gap between clinical intervention and day-to-day management. We're talking about education, symptom tracking, support systems, you name it. Honestly, it's one of the most impactful aspects of care in Alzheimer's disease. When we talk about conditions that impact the brain, another major concern comes to mind: cerebrovascular accidents, or CVAs, commonly known as strokes. These are quite prevalent, and there's a lot to unpack here. Broadly, strokes are categorized into two main types: ischemic and hemorrhagic. Ischemic strokes account for about 87% of all cases and occur when there's a blockage in a blood vessel supplying the brain.
Right, and I think many of us picture something like a clot causing a blockage. But what happens in hemorrhagic strokes?
Great distinction. Hemorrhagic strokes are caused by bleeding when a blood vessel in the brain bursts. This leads to blood pooling in or around the brain, causing immense pressure and often more severe complications. While these strokes are less common, they carry higher risks of death and disability compared to ischemic strokes.
And the symptoms, how do they help differentiate between the two types?
Both types often share some core symptoms, like sudden weakness on one side of the body, slurred speech, or facial drooping. But there are clues, like a thunderclap headache, that often suggest a hemorrhagic stroke. Either way, acting quickly is critical, and that's where tools like the FAST acronym come into play: face, arms, speech, and time. It's designed to help people recognize stroke symptoms and seek emergency help immediately.
What about treatment? It sounds like rapid intervention is key regardless of stroke type.
You're spot on, Paisley. For ischemic strokes, thrombolytic therapy, like the drug alteplase, can dissolve the clot and restore blood flow, but it's only effective within a very narrow time window, typically around 4.5 hours from symptom onset. For hemorrhagic strokes, it's more about managing the bleeding, sometimes involving surgery to relieve pressure and preventing complications, like increased intracranial pressure.
And nursing care must be such a pivotal part of all of this.
Absolutely. In the acute phase, nurses are essential in monitoring vital signs, performing neurological checks, and educating patients about recovery and lifestyle changes to reduce recurrence. Interventions might also include handling mobility challenges or supporting patients with speech and swallowing difficulties.
It's such an important role. And that brings us to seizures, a different kind of neurological event, but, I imagine, one that also deeply impacts patients' lives.
Exactly. Seizures occur when there's excessive electrical activity in the brain, and they can vary widely in presentation. For instance, we classify seizures into two main categories: focal and generalized. Focal seizures start in one part of the brain, and they can either stay localized or spread to both hemispheres, while generalized seizures involve the whole brain right from the start.
I've heard about tonic-clonic seizures. They're the ones with the jerking movements, right?
Yes, exactly. Tonic-clonic seizures, also known as grand mal seizures, involve a tonic phase with stiffened muscles, followed by a clonic phase of rhythmic jerking. But not all generalized seizures are like this. For example, absent seizures, often seen in children, may just look like brief staring spells, which sometimes go unnoticed.
That must make diagnosis more challenging. Are triggers usually involved too?
Absolutely. Triggers like sleep deprivation, stress, or even flashing lights can provoke seizures in some individuals. Part of managing epilepsy is identifying and avoiding these triggers wherever possible. And that's where tailored treatment strategies come into play, whether it's anti-epileptic medications like sodium channel blockers or lifestyle modifications like improving sleep hygiene.
Such a complex but fascinating area. I mean, both strokes and seizures show us how critical early intervention is, doesn't it?
It does. And it also highlights the vital role nurses play, not only in immediate care, but also in educating and advocating for patients in their recovery. There's so much potential to make a difference in someone's life, from those acute moments to long-term management.
That's such an inspiring reminder, Brandon. So, to our listeners, we hope today's deep dive into neurological disorders leaves you with a clearer understanding of the challenges and care involved.
Absolutely, Paisley. Whether it's Parkinson's, Alzheimer's, strokes, or epilepsy, these conditions demand attention, education, and empathy to improve outcomes for patients. Thanks for joining us today, everyone.
Yes, thank you so much. And on that note, take care and we'll see you next time.